This is season 1, episode 1. This is my journey of having MDS, which is myoplastic syndrome, which is a form of blood cancer. I was rated something what's called an EB2, which is high risk, meaning that you have a high risk of dying. So anyway, it was in 2019. I'm 57 years old. I had gotten this feeling in my chest, like my skin was tingly, that type of thing, all over my chest. So I went to the doctor, and he said, guys go through this type of thing, but let's take some blood tests, find out what's wrong. So really nothing was wrong. He said, this could be some sort of hormonal problem, that type of thing, but guys go through this all the time. I said, okay. Threw that off. I figured I'm over perfect again. Just kidding. So then probably a couple weeks later, I end up getting really sick at night. And I figured I probably ate something, but I broke into this night sweat that was hardcore, soaking wet. Now, I had had night sweats before pretty much my whole life. When something was happening, or I didn't eat right or whatever, I had some night sweats, but not like this one. This one was hardcore, soaked the sheets down, soaking wet. I got up. I went out to the recliner. I was freezing, shivering, freezing, teeth chattering, freezing. I grabbed my winter coat. Remember, it's not winter, it's in May. Grabbed my coat, got some gloves, got a bunch of blankets, put my slippers on, that type of thing. Put a hat on, even a winter hat on, because I was that cold. And I suffered through that for the rest of the night. By morning, it seemed like my fever had broken, and I felt a lot better. So now, about a couple days later, I'm at work, and one of my buddies pulls me off to the side and says, "Mike, your ankles are all swollen." I said, "I know." Now, this is someone who I respect his opinion on. And he says, "Man, that could be like maybe a heart problem or something like that. You better have that checked out." So I call the doctor again. I go back in. Now, this is a general practitioner. He says, "Let's run some blood tests, that type of thing. And then you can go, and then I'll call you tomorrow if something's wrong," that type of thing. You know how it is. If they always call you like the next day, it's bad. If they don't call you for a couple of days, everything's all good. But if it's the next day or the same day, it's bad. So anyway, I remember specifically it was 8:26 a.m. in the morning. I'm outside. I had woken up early. I had concrete workers coming to the home, and we were putting concrete around the pool, redoing that whole area. And I was running drain line from the gutters under the concrete, and it just out to another drain system away from the house, and it made it look pretty, would hide everything, which was a good thing. So my doctor calls me at 8:26 a.m. and says, "Mike, drop everything, immediately go to the hospital." I said, "What? What do you mean?" He says, "You're extremely anemic." And he says, "You need to go to the hospital right away." I said, "Hey, I'm not leaving right now because I have concrete workers coming, and I have to finish this drain system." So after the concrete workers came, this is several hours later, concrete workers come, and I decided to go to the hospital. My wife comes with me. I actually called her. I think she was out doing something. Like, "You got to come home. Doctor called. We got to go to the hospital." I'm like, "What?" So I ended up going to the hospital. They of course run blood tests at the hospital. They put me in a room with another gentleman in the room. They moved me into a room, and the gentleman that was beside me, he was actually physically fighting the doctors and the nurses. He had grabbed the remote control to the TV set in the room and smacked one of the nurses on top of the head with it. She had to go to the emergency room. And I'm thinking, like, okay, something's happened with me, but I got to deal with the fight in the room now, right? So they strapped him down. They scooted him away. I don't know where they took him. Another guy comes into the same room I'm in. And he, pretty scraggly looking, very dirty, frizzy hair. And he was rolling around in the bed, and he had soiled himself in there, and it it was reeking. The whole room was reeking. Me and my wife were looking at each other, and we're kind of like almost laughing at this point, right? Dealing with this type of thing. So they carted him off. They cleaned him up, carted him off. Now I'm by myself. So this is like several hours later. The doctor comes in, and he says, I got something to talk to you about. And he said, I said, well, do I have MDS, which is myoplastic syndrome? And the reason why I said that, I had been looking up the symptoms, that type of thing, for like different things, and it came down to a myoplastic syndrome type thing. And I just guessed pretty much. And he says, that's what I think it is. But we don't know for sure for another 10 days total, because the lab results, it take that long to do that. But what we're going to do, we're going to schedule a bone marrow biopsy. I'm like, okay, what's the first thing you do when you get news like that? Look it up on Google. What is a bone marrow biopsy? Well, I pull up a bone marrow biopsy, and people are saying this. It was the worst pain I ever had in my life. Don't ever want to do that again. All these things like that. I'm like, okay, I got to prepare my mind for some pain, right? Most of the pain in our life is right here, right? So I'm preparing myself for this. So they come in on this cart with a drill. Looked just like a drill, just like you buy at Home Depot, but it was a stainless drill. It was pretty. Had a drill bit on the end of it. I'm like, okay, where are they going to do this? Are they going to drill into my body? You ever see those crime TV shows where they're drilling through someone's hand, they're screaming in pain, they drill through their leg? Isn't that what everybody thinks? No, they're going to drill through my leg with a drill? This is serious, right? So they numbed the back of me. It's my hip area, and numbed it pretty good. And they sliced it just a little bit, and they stuck this drill in there, and they drilled into my bone. So it was completely uneventful. I had worried about something that was never going to happen. Isn't that true in our lives? We worry about things, and it never happens, right? So what's it said? I had somebody that I really cared about. She would always say this, worry never climbed a hill, worry never paid a bill, right? True, right? So I kept thinking about that, that worry never climbed a hill, worry never paid a bill. So as soon as it entered into the bone marrow itself, the middle of the bone, my body like farted. No other word I could say used to explain the situation. That's what it felt like. Although nothing came out like that, but my body like vibrated all over due to the fact that it had released the pressure from inside the bone marrow. And they took a sample. They end up stitching me back up, that type of thing. And it was a very, very small little hole. So they take that sample. The doctor comes back in and says, we don't know for sure, but the blood does look odd, but you're probably a patient that we just can't handle here at this hospital. Now, I'm not going to mention the hospital. We're going to have to send you to the main campus, which is in Cleveland, Ohio. So they cart me off to Cleveland, Ohio, in a like a van, an ambulance with no sirens or anything like that. Because I wasn't sick or anything. I felt fine. I looked great still. I mean, I wasn't white or anything. And nothing like that was happening to me. So anyway, I get up there, and they come in, and they said it's going to take about 10 days probably for the result of this. And so I was in there for 4 or 5 days more. They finally come in. They said it's MDS, and it may be EB2. And, they throw all these code words at you. I don't know why they do that. The code word scenario. I want to just come out and tell you exactly what it is, like in layman's terminology, so everybody like relieves their their inner pain, their anxiety. So of course, I'm looking up EB2 now. What that is like it's a form that you're probably going to die. It's advanced stages at that point. And remember, I had hardly ever been sick a day in my life. Hardly ever even took an aspirin or a Tylenol or anything like that. I'd broken my legs and that type of thing, my ankle and, stuff like that. My arms, I broke my arms and had stitches all over the place. Boy things, remember, hospitals are built for guys because guys, jump over semi trucks with their four-wheeler and these crazy things. We never really see women do stuff like that because I think sometimes women are smarter when it comes down to like injury. But us guys seem to be like warriors. We want to see if we can overtake that particular issue, and we end up getting hurt because of it, right? And that's what guys do. So anyway, they said it's EB2. So anyway, we started thinking about a second opinion. So we had known somebody. So they send me home now because I'm not going to like die right that day. They send me home. So we want a second opinion. We call one of our friends that we've known. Jackie knew them, my wife, and she called them and talked to them, and she trusted them. So to get a second opinion. So I decided to get a second opinion. Of course, everybody should get a second opinion. Don't even goof around with that. Should maybe even get a third opinion. We need to know what the truth is, really. It's hard to believe what the truth is anymore anyway, right? So they referred us to a doctor at University Hospital of Cleveland, which is a good hospital, and her name was Dr. Molly Galogli. This person that referred us had gone to her, and she took care of them right away, didn't dilly-dally at all, because they were being dilly-dallied at the current hospital I was at. I don't want to be dilly-dallied on. So we met her when she first came into the room. We both looked at each other and said, "Did you just get out of high school?" That's how young she looked. And as you become like a hospital patient, that type of thing, you run into a lot of people in the hospital that are doctors, that type of thing, that look like you just got out of high school or could still be in high school. They're just very young looking, which is a good thing, I think. They're starting to learn young. But Dr. Molly, I call her from here on out. She had a great bedside manner, very kind. She actually knew what she was talking about for sure. And both of us fell in love with her right away. And there was like no question. So I immediately made a decision, right? We're going to go with you. Now, as soon as I said that, she says, "Okay, we start tomorrow." That's what everybody likes, right? When you're sick, let's get going. Let's get moving here. So we ended up getting moving right away. So should we start tomorrow? So I want you to stay tuned for season 1, episode 2 of my journey through the treatments. Love you. Bye.